Hey everyone, my name is Dr. Dolores Tarver. I'm a licensed psychologist here in Georgia, and it is time for the Tea Time with Dr. Tarver is a wellness-based podcast. It is not intended to be a substitute for a relationship with a licensed mental health provider. Here we are in December. We're so excited about our health and healing over the holiday series, and I know that you all have been waiting for this episode. I saw a lot of good comments when I dropped the picture. So we're going to get right into it. Without further ado, you all know that you can drop your questions or comments in the chat, and we will do our very best to get them answered. So it is my sincere pleasure to introduce to you all Dr. Siraj Abdullah. Dr. Abdullah is a DO and CAQSM who received his bachelor's degree in psychology from Eastern Illinois University, located in Charleston, Illinois. He continued his post-baccalaureate studies at the University of North Carolina, Greensboro, before earning his doctorate of osteopathy from the Edward via Virginia College of Osteopathic Medicine in Blacksburg, Virginia. He completed his family medicine residency with Palmetto Health at the University of South Carolina, where he also completed his sports medicine fellowship. Dr. Abdullah is currently a sports family medicine practitioner in Phoenix City, Alabama, and in Columbus, Georgia, and he focuses on orthobiologics, concussion management, all non-operative orthopedic injuries, and diagnostic interventional ultrasound for musculoskeletal problems. That was a whole mouthful. Welcome to the show, Dr. Abdullah.
Thank you. Thank you for having me.
Absolutely. So let's get into it. We know that every year lists come out during this holiday season about the top gifts for men. So I was wondering if you had to create a top 5 things for men's wellness, what would be on your list?
For men's wellness.
Men's wellness.
So I think if I had to make a top 5 list for men's wellness, I probably would focus a little bit on mental health. Of course, you probably can relate to that. And I think that is different for everybody. For me, I love to travel. And so if I had a gift that I wanted, I would request, like just a travel vacation where I can get away and relax, whether it be at the beach or the mountains, if someone's able to do that. Secondly, I'm of course on sports medicine, so I like to work out, but also I encourage that. And so again, this focuses on mental health, but also focuses on just physical health and trying to, and so I would request, not a gym membership, but just, somewhere where I can just work out, whether it be on the beach or whether it be at a home gym. I'm gonna tell on myself a little bit. I have
tell on yourself.
It's probably bad, I think about mental health and wellness, but I had my first massage, within the last year, went to Costa Rica and had a massage there. And so that was my first one. So I would encourage most men to try to, incorporate that into their regular routine, because I think that helps just from an overall well-being standpoint. A lot of times we gift our wives and girlfriends and women with that. But I think, overall, it actually can be beneficial to treat yourself sometime.
So it's never too late.
Never too late. The other thing I'll probably, of course, as a sports fanatic, more taking care of athletes and things like that. We got the World Cup going on, and so if I had my biggest gift, I was like, send me to like one of those big events, whether it be the World Cup or, you got football championships coming up, Super Bowl. So
giving people some suggestions for some nice gifts for the men in their lives.
But you get the college football championships coming up. You get the sports Super Bowl coming up, and so those would be some things I would look forward to.
So that's a pretty nice list. So mental health, making sure that people are attending to that. But I heard you say physical wellness, and no, you don't have to join a gym, but that you're getting some physical activity. The massage pieces, I like to hear you say that, because I do think that sometimes men don't necessarily think about massages as good for their health, but it sounds like you enjoyed your first massage.
I did. I haven't had another one yet, but
But I think a good option, and I heard you say a lot about just getting out. So whether that's the beach or mountains or just getting some good air in there, sounds like that's really important. And then doing something people enjoy. So if that's a tickets to that game or something that we don't often, I think as men, you all don't necessarily get permission in the same way that women do to
Mhm.
be able to engage in some of that good wellness. And I'm hearing you say like, hey, hint at those loved ones in your lives, what you might like so that you can take some time to take care of you.
Yeah. Socks are fine, ties are fine, but every once in a while we want something that we can enjoy.
I think that is probably the most talked about gifts ever. It's like the socks and the mugs and the ties. Like we have plenty. No, thank you. Here's some other
Yeah,
things
yeah.
that you can consider. So I do appreciate that. So we were joking about it, but what do you think are some of the reasons why men do have maybe a harder time taking care of themselves psychologically as well as physically? That they don't necessarily uh, invest in themselves in that way.
Um, I think men have a hard time taking care of themselves is a couple reasons. Are not one from a society standpoint, men are supposed to be the caretakers of the family in the sense where women are caretakers of the children and things like that, but we're supposed to be able to hold down the household essentially, and be strong for the household, and also and from a financial standpoint, from a spiritual standpoint, and so oftentimes we see that okay, if we are strong for the household, then or for our community, then we should not need assistance from medical professionals or counseling or physicians, because we got this. But in reality, oftentimes men uh, are human, of course, and so dads and fathers and brothers and uncles and things like that. And so your stress comes at us just like it comes at anybody else. And oftentimes we try to bury down that stress and hide that stress. And then it comes out in other ways. It can come out in ways such as, men, you may become more irritable where you're not enjoying life. You may not be enjoying your family. You may not be enjoying your work. And you're just going through the motions. Sometimes it can come out in ways where you're not sleeping as well. Other times it can come out in ways from a sexual activity standpoint where you're not as sexually active. You may have decreased libido. You may have erectile problems. And so, we still deal with this, and our body lets us know about this in different ways. But we just try to push on and say, oh, it's going to get better. So I think, oftentimes asking for help sometimes is seen as weakness. But oftentimes, that's the only way you're going to get through some regular times, but oftentimes stressful times. Work is one thing, but then you got to work on it. And then you have children, and then you may have relationship problems or just struggles. And then you may have a death in the family. And then a pandemic hits. And it's like, all right, well, this is a lot. And so in my practice, I see a lot of different individuals from 18-year-olds to 85-year-olds who may have anxiety, who may have depression. And so that's very important. You be able to, one, understand yourself, but understand, what type of resources you have. Of course, my reference point is from athletics, but I deal with the general population. But we watch a lot of athletes on TV. We watch them from a college level to a professional level. Most high-level athletes have some type of professional in their lives to help with mental health. Sports psychology is a big thing where, a lot of times people think about sports psychology from a sports performance standpoint, but you can't really perform well if you have anxiety. So oftentimes the counselor and the psychologist have to work through the anxiety, the depressions of other things first before you can get to that performance level. And so, quote unquote, regular people, your performance is just taking care of yourself, taking care of your family, taking care of your work. And so again, mental health is very important.
And I'm hearing you say that because I do think, and I appreciate you all the shout out to mental health. Thank you so much.
Yeah.
But also, I don't think that sometimes men are aware of how connected mind, body, and spirit are. And I'm hearing you say that sometimes it is these physical manifestations are coming from perhaps psychological things that
Correct.
men may not be aware of that could be why they're having some sexual dysfunction or why they're having some problems sleeping or why even they may be having some pain that may be showing up in parts of their body, trembling that they may not necessarily be aware of. I like how you talk about, because I do think that sometimes people think like, okay, athletes are not real human beings, right? That they're in this other category.
Yeah.
And I like that you normalize, like athletes experience these things too. So you can be at the peak of your performance and still be having these difficulties, and there is no shame in you getting help for those things because it's about you performing to the best of your ability.
Correct. Athletes, entertainers, I work with entertainers also, and I mean, same thing where they also, I mean, one in particular, and is a professional called me and said, hey, you know, if you say something that can get him worked up, he may not go out and perform. And so it's one of those things where, you know, you just have to be aware of yourself. And once you become aware of yourself, I think you can be a better friend, husband, brother, in general.
So I'm hearing you say a lot of these things are manageable if a person would come in and have a conversation.
Yeah, and a lot of times with men, I'm guilty of it also. Oftentimes we say, okay, this is going to get better. And oftentimes we say, I'm going to go in next month. And then something happens where you feel like, oh, I got work late, or I just want to go hang out a little bit, or I'm tired, I don't feel like going in. And so then, you know, you keep pushing it off. And then once it becomes too much, that's when you try to go in. And, you know, of course, in our society, we think it's going to be a quick fix. But, you know, something's been going on for a year or 2 years or 3 years. One visit to the doctor is usually not going to take care of it. And so it's an ongoing process. I think about it as like if you are learning how to play basketball, you don't really just go out there and practice one day and then all of a sudden you're shooting threes like Steph Curry, or if you trying to get weightlift and things like that. Is I think your mind is similar to a muscle where you just have to practice, try to get that better, to try to understand how to better help yourself.
Absolutely. I appreciate that realistic perspective about being able to address things. It's not usually a one and done kind of scenario. You have to come in and get initially, maybe it's a diagnosis or some thoughts, and then a treatment plan could entail some other things. Yeah. So speaking of which, I know that sometimes, so you mentioned from 18 to 89. So you're seeing males at a variety of ages, young men at a variety of ages on up through adulthood. Talk a little bit about like when do men, or when would you recommend they start coming in to get checkups? Is this something you mentioned you kind of wait, let's see if it's going to go away, but is there a recommendation that you may have about men and the frequency of which they should be seeing providers?
So I think it depends on the individual. I can't really make a blanket statement and say that you should just come every 6 months, every year. If I'm thinking about, you know, children, of course, they're going in for their wellness visits. 18-year-olds, typically they're young men. And so I think it's for everyone, the blanket statement I will make is important for everyone to have a physician that they're established with. So if something does come up, you can go to that person and say, hey, this is what's going on. And instead of using Google and start Googling things or asking your boy about it, you know, it's better to, you know, be able to go into that provider and say, hey, this is what's going on. What do you think about it? And I tell all my patients that I'd rather you come and ask me about it as opposed to being at home stressed and worrying about or asking one of your boys at work who, may have just as much education or may have another uncle who dealt with this, but it could be something totally different. So for everyone, 18 years old to 90 years old, I think it's important to establish with a physician to say, just to have that person. And then, 18 years old, most of the people at this age don't have a lot of medical problems. We're seeing more and more that, people are more sedentary. So you are starting to get people that's 18, 19, 25 years old with diabetes or high blood pressure. And so if you have those type of issues, then talk to your provider and they'll let you know how frequent you should come in. When you start getting to your 40s and 45, 50s, it is important to be able to go there probably at least once a year if you don't have any medical problems, probably twice a year if you have medical problems. And that will help you determine, or help you get baseline labs that will say basically, okay, if you have high cholesterol, if that's something that can be addressed early. 45 years old, that's when you start thinking about prostate. Nobody likes going in and talking about the prostate, but it's an important thing. And at 45, if you start getting that blood test, or, of course, you think about the digital rectal exam, I always tell my patients, I don't like doing this, and I know you don't like it either, but it's a necessary evil. And so at that age, that's when you want to start going in and getting that check, because the goal is basically to catch things early. If we can catch things, so if somebody has prostate cancer and we catch it at 45 as opposed to 50, or if we catch it at 50 years old as opposed to 55, then the treatment plan is going to be easier. And, of course, with cancer, it can spread. Same thing at 45, that's when you start thinking about colon cancer screening. And so those are times that you want to be able to go in and have your physician schedule that for you. Again, and we all hear about, we're seeing more and more, but, I think now people are realizing it more after Chadwick Boseman, with his diagnosis, but this has been going on for a while. And so it's very important to be able to get those initial labs from a baseline standpoint, because that's when, we can pick up things such as high cholesterol, and pick up things such as some cancers. Now, if you have any kidney issues, a lot of people walk around with elevated blood pressure. And they don't know it. And that's why we call it the silent killer. If you're walking around with elevated blood pressure and it's not treated, then that puts you at risk for heart attacks and kidney disease and actually kidney failure. So that's why it's important just to go in at minimum once a year. And then once your provider sees you, then it may need to be more than that. Other thing I will say is, I talked about the prostate cancer screening and also the colon cancer screening, but it's important to know your family history. So if mom or dad or brother and sister had colon cancer at 40 years old, you actually need to be screened earlier at 30 years old. But if they also had heart disease and, you had a mom or dad or uncle that died from heart disease at the age of 50 years old, then you may need to be screened earlier to see if there's a genetic component or is there something else going on.
I guess let me kind of back up. So one, I'm hearing it's important to have a provider. So if nothing else, like have a primary care physician, a pediatrician, if they're under the age of 18, but that you do need to have established care with someone.
Yes.
So that you can have a place to go to get either these baselines, or if you're noticing some of those issues that you were mentioning before, like I'm not sleeping well, or I'm noticing some changes in my body. Instead of that, well, let me just wait and see what happens. Let me actually go and attend to it. So if I notice something is off, and it's off for more than a few days, it's not getting better, I'm seeing this pattern, then if I
Mhm,
have a
mhm.
provider, maybe it'd be more likely that I would go
Yeah,
and give that person a call.
right.
Another thing I heard you say, and we probably all have stories or have heard stories of men who had a heart attack. So
Mhm.
out of what we perceive to be out of nowhere, a heart issue, come to find out they had elevated blood pressure, but they had not been monitored by. So I want to talk a little bit more about that. What are some signs and symptoms that a person may be having high blood pressure?
So sometimes there is no signs or symptoms. So that's why it's being a plug just to say, have a physician that you can go see, a provider that you can go see. Sometimes you just, oftentimes I get people coming to my office where at a job, like especially if you're a truck driver or something like that, you're doing DOT, that's when they find out they have blood pressure. But some signs and symptoms that if your blood pressure is high, you may have ongoing headaches. You may have blurred vision. You may feel more tired than usual. It's pretty severe if you start having chest pain.
Mm,
Um, and so those are the more common type of things. Dizziness, if that blood pressure is really high, that also can cause dizziness too. So, but it gets pretty concerning if you start having those signs where you're having blurred vision, loss of vision, headaches, dizziness, chest pain. Erectile dysfunction also is a sign because the way you get erection is blood flow, and if your blood pressure is running high, then you're not getting blood flow to other places, such your brain or your penis, and so that's one of the things also. That's usually what bring people in.
is that what brings me
Besides,
in?
something's not working right, and it's like, all right, well, what's going on? Let me get this medicine so I can continue on. But usually, once they're in the office, we can talk about some other things and find out, is that the reason you have erectile dysfunction, or is it something else? Again, going back to the anxiety and going back to the stress level. That's another thing that could be causing that. So,
I'm sure they probably don't want to have that conversation about how you're not going to prescribe them a pill to help with their erectile dysfunction when their blood pressure is.
yeah, I had a couple people get mad at me when your blood pressure is 180 over 100, and that the Cialis is not going to do it. And so we got to work on some other things
Mhm,
before. If your blood sugar is uncontrolled and your blood pressure is uncontrolled,
mm.
then it's probably work on getting those things. And so that, yeah,
Maybe that's a motivator though. So
that can be a motivator.
yeah, like, okay, well, let me get my health in order so I could
Right,
get my sexual health back where I want it to
right,
be.
right.
I also heard you reference Dr. Google, my favorite. So I'm hearing you say to the brothers out there, please get off the internet and instead come in and see your
Yeah.
provider when you have some questions or concerns.
Yes, most Google searches are going to lead to one or two things. You're going to stress yourself out, or you're going to misdiagnose yourself, and you're going to ask somebody, and they'll tell you you have cancer. And so it's better just to come in and talk to somebody who's knowledgeable, because it really is not just about, okay, if you have um, one symptom, that doesn't automatically equal a specific diagnosis. So if you have chest pain, that doesn't automatically equal a heart attack, but it's better to come in to be evaluated. Could be a heart attack, it could just be muscle pain, it could be pneumonia. But the only way to find that out truly is to come in and have an evaluation.
So you mentioned sometimes the sexual dysfunction is one of the main reasons you'll see men in your practice. What are some other reasons that men do come in to
The
see you?
wives.
Top two answer is wife made me.
Right. No, but within the last 2 years, actually, I've seen more men actually come in by themselves
Okay.
because they've been more stressed. They have noticed the blood pressure. Some men just, I've had actually more and more surprisingly come in 30, 40 years old just to be established, just to make sure they have a
Mm,
provider.
okay.
And I always congratulate them for that because
Yeah.
it's not as often. Um, the But yeah, I would say number one is erectile dysfunction. Two is just a checkup. Other times they have noticed at a physical or one of their work physicals they have, the labs have been somewhat abnormal, blood pressure has been abnormal. Um, you know, and then I guess one of the other, as we get into the older men, sometimes it is more so due to prostate issues, such as
Mm,
not just prostate cancer, but enlarged prostate.
mhm.
That's another thing that affects, as you start getting older, 50, 60, 65 or so, sometimes it's younger, you start getting enlarged prostate. And sometimes that can cause some problems with your urination.
Mm,
Some people may get more urinary frequency where they may go to the bathroom and then 15 minutes later they have to go back.
mm.
They may have a weaker stream where, they always say, at 16, I can write my name in the snow when you're in Georgia, no snow, but now it's more like a dribble.
Yeah,
Or they're waking up 5 or 6 times a night
yeah,
to get up to
yeah.
pee. And so those are another things that may come in and to be evaluated for that. Um,
And I definitely recognize that those are probably some of the more common reasons why I see men in mental health counseling as well. It's
mhm,
because those are the types of changes where we're talking about frequency of urination or not being able to get an erection, where men are feeling a blow, I think, to their
mhm,
worth and
right,
identity when they're not
right.
able to the things that they identified that gave them strength as a man. When these things
Mhm,
are
mhm,
different, that's when
right.
they'll come in and they feel I hear them say they feel broken
Yeah,
when,
yeah.
like you said, they're not able to do some of the things that they used to do when they were younger.
Correct, correct. Yeah, and so you'll hear a lot of advertisement about erectile dysfunction and
Hmm.
the BPH and benign prostate hyperplasia or enlarged prostate.
Mm,
And so, and also I think the one other thing would be decreased sex drive. I have some people
mm,
come in for that. And usually the first question is, I need my testosterone checked.
mm,
Um, and decreased sex drive does not always equal low testosterone. Erectile dysfunction does not always equal low testosterone. Like I said before, it could be a blood pressure issue. It could be over stress issue or just a stress issue, anxiety issue. It could be a diabetes issue. And so it's a lot of things that can cause that. As we age, testosterone starts to trend down. So I think after about the age of 25 or 30, you reach your peak, and then after that, everybody's testosterone is going to decrease. And so the goal is to try to decrease the way to decrease the chance of testosterone going low is staying active,
mm,
staying active sexually, but also staying active from a physical standpoint. So as we build muscle, we think about building muscle in the younger years, and then once we get 40, we get busy and we don't work out as much. At 50, you're stressed out. 60, you feel like you don't need to do it. But as you maintain that muscle and build more muscle, that actually helps maintain your testosterone. As you gain more weight, the fat cells actually have more estrogen. And so trying to have a balanced activity level, whether it be weightlifting, cardio, that's very good, but also having a balanced diet,
mm.
this, balance in protein, balance in vegetables, and that also can help over time to decrease the chance of the testosterone falling.
I know I do see a lot of low T commercials, and a lot of
Hmm.
times men are wondering about their testosterone. I'm happy to hear you say, hey, there's some other things that could be going on, which is again why you need to have a conversation with your physician so you can really discern what's going on instead of assuming that it's something and ordering something off Amazon
Correct.
to address something that may not even be the issue.
Hmm.
So I know that, you gave your healthy list of 5 good things that men could do, and you have brought them back full circle with mental health and physical health and also the nutritional health and wellness and doing, you know, things that men enjoy, not just having to feel like they're only in this role of provider, or that they have to hold up the family, but they get a chance to be well-rounded and check on themselves as well. But I know that some men have on their wish list things that might be different than what you have on your wish list that may not be healthy for them. So talk a little bit about maybe you mentioned the food intake. Talk a little bit about maybe some of the things that men may be enjoying that may not necessarily be as healthy for them.
So common thing has been common. Football season is in, so of course, alcohol. It's not a bad thing, but at the same time, when we think about alcohol to excessive amount, that goes back to what we were talking about from a blood pressure standpoint, also from a weight gain standpoint, but also from a relationship standpoint. If you are drinking excessively where you are missing work, or it's causing relationship problems, or it's affecting your daily life, or you feel like you just can't start your day without drinking, that I would highly recommend that you talk to a professional about that. But just over time, what I see is, if you're drinking more, it does affect your sexual health. It does affect your blood pressure. Also, long term, it can affect your liver, and that's one of the causes of cirrhosis.
Mhm.
Other things, we are in our society, we eat a lot of fast food, we eat a lot of foods that's high in salt, a lot of foods is high in sugar, processed food. So oftentimes I tell people, if it's white, it's not right. So basically, from a carb standpoint, it's okay to eat pasta, it's okay to eat white rice every once in a while, but over time, if we're doing these things and we're not burning those calories, that's going to put us at a risk for gaining weight. And so, as I mentioned before, as you gain weight, that puts you at risk for low testosterone, potentially puts you at risk for diabetes and high blood pressure. Um, Oftentimes, what I'm seeing more and more is something called fatty liver disease,
Mm.
where we are eating more processed foods, more fried and fatty foods, more carbohydrates, and our liver processes this, but over time, our liver gets burnt out.
Mm.
And so it's not able to process it. And so that's actually, I think, the second leading cause of liver failure,
Mm.
because we are eating these things, too much of them. And that's also one of the causes of diabetes. Um, you know, um, Marijuana is legal in a lot of states now.
Mhm.
But again, too much of anything, it can be cause a problem. And so even with, I may get some frowns and bad looks on, I can't see anybody, but
No, you
uh,
can't see them.
yeah, even with marijuana, you'd have the CBD, but also over time with marijuana, we know that it can affect your motivation. At times, with younger men and sometimes older men, it can cause something called gynecomastia, or
Mm.
quote unquote man boobs,
Mhm.
because I guess that's not professional, but that's basically what happens, is that over time it can cause that, and that's another thing that can affect your testosterone over time.
Mhm.
Um, and so, of course, if you're smoking every day, a blunt here, a blunt, on a daily basis,
Mhm.
then yeah, it potentially could affect you, one, from reaching your goals, but also just your overall physique, but also your testosterone. It's still early on right now. We don't know if it affects from a lung standpoint, but you're
Mhm.
breathing in something else besides oxygen. So,
That
um,
I did not know that about I mean, some of those things I knew, but
mhm,
I didn't know about yeah, I do think people probably know the man boobs term, whether
yeah.
it's, medically professional or not. But I think they probably recognize that term, or I did not know that that had was a cause.
Mhm. That's one of the causes. Not saying it's the only cause,
Only
but
cause, but a
oftentimes
cause.
it can lead to that. And so a lot of times I'm seeing people in high school or college,
Mm.
and they're more sedentary and they're smoking more. That's one of the things I try to bring to your attention.
So is it the being sedentary that's causing it, or is there a link to the THC, or we don't know?
We don't know yet,
Okay.
but usually most people not smoking and going out and running. Or most people not
Probably
smoking.
not.
Yeah. You're smoking, you may get a little munchies.
Fair point. Fair
So,
point.
but no, so typically, you're trying to have more of that balanced type, protein. You hear a lot about protein now, but and you hear a lot about different type of, special diets like keto diet, if that's the realm you're in. But, it's trying to have that balance where if you're doing protein, you want to have the lean protein. So the protein is not causing more problems to the liver and causing your cholesterol to be up. The carbs, I try to incorporate the complex carbs where you're not doing as much white rice and pastas on a regular basis. And so those things over time can help maintain muscle over time if you're working out, building muscle, which can, again, lead to I think, a healthier lifestyle.
So we can't eat a lot of fried stuff. We can't eat a lot of processed stuff. So you're telling them no fun in your food. No.
In moderation. In moderation. So a lot of times what happens is, so you asking about the most common things, and of course you got to know your family history.
Mhm.
And most people have somebody in their family history who has diabetes.
Mm-hmm.
Most people have somebody in their family history who has high blood pressure. And people think because mom and dad had diabetes, that means if I get diabetes, I have to keep diabetes. But that's not true. Oftentimes what happens is that we take on what our parents do.
Mm-hmm.
And so if Big Mama is eating, greens and rice with it, and you put a little cornbread in there and pork chops and whatever like that, that's good food to us because that's what we grew up in.
Mm-hmm.
But over time, though, what happens is that my grandparents, they may ate that, but they were also, unfortunately, my grandmother was in cotton fields working, but also she was in, back then people walked a lot more, they were more active. And so, but now we try to eat the same thing and we are not as active, but also the food is totally different now.
Yeah.
And so if you are diagnosed with diabetes or if your parents have diabetes, that does not mean that you just continue to choose to have diabetes. If you change some of the things you eat, then, or even change your activity, then that means the diabetes actually can be treated. So
I think that is very helpful for people to feel empowered, like they don't necessarily already have, health issues mapped out for them just because of their family history. But recognizing some of those factors, like we can't be eating the greens with the hog maws in it and wash it down with the macaroni and cheese and then have a pork chop. And and then because we have to have something white, then I have to have some rice or some potatoes to go right. But it's not that I can't eat the greens and I can't eat the cornbread, but maybe I want to be careful about what I'm putting in them so that I'm not putting the fat back in the greens, and that I can make the cornbread actually without the egg and without the milk and still be able to get some cornbread, and I don't have to have a piece that's the size of a plate.
Right. And that's the thing is the portion size also that we oftentimes think we need more than we really need. And greens are good. I mean, that's actually a good healthy source for us. I mean, cornbread can be good for you also, but it's just one of those things in proportion and also how you prepare it. So
absolutely. And I think that's the empowering piece that you just said. Like you can have them, but look at how they're being prepared and look at how much you're having of them. And then I also heard you say earlier too about like the alcohol, because I do realize, and men will I think you talk about those genetics, like, oh, we all get the beer guts in our family, so I'm gonna have a gut anyway. And so they feel like there's nothing they can really do about the gut. But I'm hearing you say, well, you actually can do some different things to be able to help with that.
Right. And also one just going back to the alcohol, a lot of times I think it is more of a cultural thing, but at the same time, I've had some men come to me and say, hey, this is just how I relax. And so going back to, if you have a stressful day, you relax with alcohol, and then sometime it turns out to where this is the only way I can relax. And so it's really important, and be able to have some avenues to be able to deal with the stress besides alcohol. But yes, over time, alcohol, you drink it too much, it has calories, and so yes, you're going to get the beer gut, but also eventually, potentially, could affect your liver and other things too.
Yeah. You mentioned that fatty liver piece. So like we're not just getting fatty liver from drinking. Sounds like we're getting fatty liver from some of those processed foods that you were talking about over time that our body's having a harder time breaking down. So as you talk about empowering people, what are what is a small step? Let's start there, because I realize that sometimes we just don't know where to start. You're hearing all this good information that you're sharing with us, and they're like, okay, well, I'm doing all of that stuff right. So, and I know sometimes, like you said, when you're just overwhelmed and it causes you stress, and then we tend to avoid, like, okay, I'm just not going to deal with it at all. Right. So what would be one small step that a man could take toward getting his health back on track?
Finding you a good physician or provider. I would say that would probably be the first step, because then you have somebody who can educate you in an honest way, and also just be able to look at the full picture. But so that would be the first thing, is finding someone who you can go to and ask questions to, and check your baseline labs, and do a thorough physical examination. Short of that, I would say thinking about, as we mentioned, the type of foods, everybody has their weakness. And so thinking about the type of foods that you eat, and is there anything that you feel like you may be able to change? When I say this, a lot of people think, oh, I need to go eat salads, or I just need to go vegetarian, but it really is, most people, it's 2 or 3 things that they indulge in. It could be soda, it could be sweet potato pie or desserts, or it could be bread. So find out those things that you may, or we talked about the alcohol. Find out, what's your weakness, what's your kryptonite, and so if you can find that, then you can do that in moderation or do away with it. And then the third thing I would say is, I'm a big advocate of just regular physical activity. And a lot of people think they have to go to a gym and go work out for an hour. I'm not sure what your audience is, like what age group. They should probably everybody. But as we have more responsibilities, we get older, you have a family. A lot of times going to the gym for an hour is not reasonable. Maybe it's doing some body weights, or if you got a treadmill, or you can run in the neighborhood for 15 minutes. Push-ups, just regular body weight type of things can help. And if you do that for 15 minutes a day, some type of activity that helps in multiple ways. It helps maintain that muscle mass, it helps with testosterone, it helps overall health, it helps heart health, it also helps mental health. And so there's been studies that show that if you do about 15, 20 minutes a day, 3 times a week, then that actually can help you in the long term. And start off small. If you can't do a push-up, just do some air squats, or do some bands. So
yeah, I appreciate always just a small step, because I know sometimes it feels like we have to go from the couch to bodybuilder. But I'm hearing you say you get good 15 minutes of things you can do with your body weight at home. That's a good first step. It doesn't have to be 3 hours in the gym. It can be just starting small with the moving. Yeah, I appreciate that, because that sounds much more reasonable.
Yeah, I mean, I'm gonna be honest. I mean, I work a lot. I'm sure you work a lot, and oftentimes an hour in the gym, 2 hours in the gym for me is not reasonable. And so that's why I tell people, and don't beat yourself up. If for any reason that you're on a good track and you're doing it on a daily basis or 3 times a week, and you miss a week, just try to get back on track. The same thing for eating wise. A lot of people, we're getting to the point where, people are thinking about New Year's resolutions.
Yes, we are.
So, those New Year resolutions sometimes can be broken, but also just take those small steps, think about what you can do to help your overall health. It could just be taking one thing away or adding in one thing. And then, that next week or next month, take out one more thing, add in another positive thing. And so you start doing that until you start having a more of a lifestyle change that will help you out.
I like that because I think a lot of times when we're stressed, and you mentioned a lot of things that I think men are dealing with, they could be working long hours. They may be, you mentioned truck drivers. I think a lot about them, and they're sedentary in those trucks and often gain weight because they're eating a lot of junk on the road. I hear a lot of men say like they just don't have that time necessarily because of how they work to eat those healthier meals. But I'm hearing you say like you can just make some small changes. You can look at what you're doing that may not necessarily be as healthy and pick one thing and add one thing. I do like to tell people don't take something away if you don't put something in its place.
Right.
So add one thing after you take this one thing away. Like, so if I'm going to, so chips is my nemesis. So if I'm going to cut back on my chips, what is something that I can eat instead of chips? That'll be quick, but give me a little bit more nutritious bang for my buck.
Yeah. I agree. And I say that a lot with, so I talk about diabetes and high blood pressure and other different type of issues. And so when people start doing well, where their numbers are getting better, always, try to encourage, like, we can take away this medicine, but if we take away this medicine, you have to continue to add on something that's going to help you over time.
Yeah, I appreciate. I think that was your gift to the people, is work on removing something that's unhealthy and adding something that's healthier.
Right.
Are there any other recommendations or books or podcasts or resources that you want to share with everybody before we wrap up for the evening?
Well, I think, just a good resource. I think you probably can add in a couple more resources. I think about reputable resources. And I think about there's one that has general information just about all different topics, and that's American Academy of Family Physicians. They basically have a lot of different topics that you can look at, and I think it's a reputable source. I know it's a couple of other ones out there, but that's the one I will go with right now.
That's a good, I do think it's important for people sometimes shy away from medical resources, even though they'll get on Dr. Google and look at Wikipedia. But, I do think it's important for people to realize that a lot of the medical associations, as well as the psychological associations, have very easily digested information on them too. Correct. So it's not that you get on and you're like, I don't understand any of those words.
It's not research articles that you're looking at. It's more just for patient.
Right. So I appreciate you saying that no, these are the patient-friendly websites where you can go and you can get information, and sometimes nice videos where people are sharing information so that you can have something, as you said, while you're sitting talking to your coworker who doesn't know any more than you know, but is telling you information that he heard secondhand from a third-hand source. Like, if you're gonna get it, go get it from somewhere that is actually
get it from somebody else.
that is accurate. Like, these are actual professionals have put this information out. But more importantly, get you a provider.
Correct. Yes. I think for everybody, no matter if you don't have any problems or you have 15 different problems, it's one of those things to get somebody who you can trust, get somebody who you can talk to. And you feel comfortable with. You may not always feel comfortable, but as you build that relationship, I think that comfort will come, and you should be able to go in there and talk to them about everything, whether it's a silly question, you feel like it's a silly question, but that's what I encourage everybody to do to their physicians is be honest. Okay.
That was the second present for people. Be honest. Like, it doesn't help you to go in there and not tell the truth.
I sometimes get people, new patients come in, and they will, I'll tell them I'm gonna do some testing, or I'm just I just take a history. And some people shy away about telling me. Some people are completely honest about everything they've done. Some people shy away about telling me, their sexual orientation, or if they're using any type of drugs, whether it be marijuana. But some people use meth, some people use cocaine, and so don't advocate that. But if you tell me that, I can better treat you. If I don't know that, actually, I can give you a medication that can counteract with that, and it can harm you. And so most physicians, if not all physicians, want to help you as much as possible, and that's the only way we can do that, by having all the information.
Absolutely, absolutely. Well, I want to thank you, Dr. Siraj Abdullah, who came fresh off work and got on this podcast for you all this evening. So I thank you so much for giving of your time to an already long day to be able to give some good health information to our audience. Join us next week for Dr. Katina Strozier is going to come in. 'Tis the season for your self-care on next Tuesday, the 20th, back at our regular 7:30 time. Dr. Abdullah, you take good care of you. To the audience, everybody be well.
Thank you.
Thank you.